Dr. Michelle Cretella is going to talk about the childhood development issues on gender identity. In other words, pushing the transgender agenda on kids, what this really does to them. Dr. Cretella is coming via Skype. So, Dr. Cretella?
Thank you. All right. Trying to understand the transgender cult, it's necessary for us to first understand how a normal child develops their gender identity and contrast that with the gender ideology in the schools. Next slide. I'm sorry I can't be there in person, but I thought I'd throw up a little picture for you. I do exist. I am the president of the American College of Pediatricians. We are a pro-life, pro-family national organization of pediatricians. I also have 4 teenagers, 3 boys and 1 girl. I did list a few titles of different publications I have regarding transgenderism in children. The medical term is gender dysphoria. Next slide. Do not be deceived. Sex really is a binary trait. That is the norm for human design. XY chromosomes, you're a boy. XX, you're a girl. Those are not genetic markers of a disorder. Next slide. Now, everyone is born with a biological sex. But as we know, things can go wrong. When a baby is born without having clearly boy parts versus girl parts, let's say, we call that a disorder of sex development. You will hear it sort of colloquially referred to as intersex. This is rare. It happens in 1 out of 1,500 to 1 out of 2,000 births. What is important to understand is that intersex is not transgenderism. Intersex is a diagnosable medical condition. Intersex is also not understood as a third sex. There are 2 biological sexes. Next slide. No one is born with a gender identity. Gender identity is an awareness of ourselves as either male or female. Identity exists in the mind, not in the body. Gender identity develops over time, just as all other self-awareness and self-perceptions develop over time. Next slide. In general, gender identity development in children begins with infants being able to recognize sex differences. And if you're in the pro-life movement, this probably won't surprise you, but even in the mother's womb, the baby begins to distinguish between the mother's voice versus the father's voice. Within the first few months of life, infants can distinguish between female and male faces, and by 6 months, infants discriminate between both faces and voices by sex. Next slide. Approximately at 1.5 years of age, that is about the earliest time that a child may say, I'm a boy, I'm a girl.
At that age, they will typically begin identifying with the same-sex parent. The majority of children will accurately identify their own biological sex and that of others as boy versus girl. But this is very important. Children may not understand that sex is constant before ages 6 or 7. So children under ages 6, 7 may actually think that your sex can change. Next slide, please. Now, this development of a gender identity can be derailed even early on. It is difficult for us to know, is it just a phase? For example, if an 18-month-old identifies himself as the opposite sex, that's so early in development. I tell parents, don't be concerned about that. You simply affirm the little boy in his biological sex, and you wait it out. It may just be a phase. However, some children may develop a subconscious perception that it's unsafe to be the boy or girl that they are. They might have this sense that it's unsafe to be their biological sex, or that there is something unlovable about their biological sex. I am aware, for example, of some children who experienced this because parents were going through a very difficult, nasty, and violent divorce, as an example. Other times, it may be a very innocent dynamic going on. For example, in one case I was aware of, the little boy had a younger sister who had special needs. And he saw his parents having to spend so much time and attention with her. He psychologically internalized that mommy and daddy only love girls, I'm not lovable as a little boy. Now, again, psychology exists, and not all little children will interpret the same scenarios in the same way. But I just wanted to give you a couple examples of what can go wrong and be helped through therapy. Now, it is also possible for children to be undergoing severe abuse. For example, I had one therapist reach out to me to thank the American College of Pediatricians for our writings, because many of his patients who are now adult transgenders became that way because they suffered severe sexual abuse. So it's really a whole gamut of possibilities. Next slide, please. Now, I want you to hold on to this basic understanding. If a person believes that he or she is something or someone he or she is not, best case scenario, this is confused thinking. Now, if it's really persistent and severe, it would be called a delusion. So when we have children who are struggling with this, with their gender identity, it is important for parents and peers and schools to consistently affirm the reality of their biological sex in very compassionate, loving ways. Next slide, please. Unfortunately, the transgender activists are very prominent and prevalent in mainstream medicine and psychiatry at the present time. And what pediatricians and parents are hearing and being told, and this is being reaffirmed by Hollywood, is that it doesn't matter how young the child is, you affirm the fantasy, or else they'll kill themselves. There is no science to back that premise. In fact, what we do know, based on the studies that have been published so far, is that children who are told to act like the opposite sex, and they are affirmed this way, they get put on puberty blockers. Puberty is not a disease. It should not be treated as a disease. And as a matter of fact, when these children are allowed to go through puberty naturally, that is often curative. However, instead, they are being put on puberty blockers, and these can be dangerous because it stops their growth. It stops the development of their eggs and their sperm, and it even halts their brain development. Next slide, please. Here on the slide, it mentions the DSM-5. This is the psychiatric Bible, if you will. And if you look at the chapter on gender identity, you are able to calculate the percentage of gender-confused boys who will ultimately accept their sex. In some studies, it is up to 98%. You can also calculate that as many as 80% of gender-confused girls will eventually accept their biological sex after passing naturally through puberty. Next slide, please. Here is the most important fact that parents and therapists, I would say, and physicians need to be aware of. When young children are encouraged to impersonate the opposite sex with hormones before puberty, they will be permanently sterile. This is being kept out of the public realm. And it's also difficult to find in the medical literature, but it is being brought up a little more frequently now. Next slide, please. Once the children are put on puberty blockers, they are often started on sex hormones of the opposite sex. So if you're a little boy, prior to puberty, you want to be a girl, you're put on the puberty blockers, and then you'll also be started on estrogen. If you're a little boy who wants to be a girl, they'll give you estrogen. If you're a little girl who wants to be a boy, she gets put on testosterone. And as you can see here are some of the very serious diseases that these artificial hormones will cause in the wrong sex. Next slide, please. If we look at what happens to adults who use the cross-sex hormones and also have sex reassignment surgery, their rates of suicide are almost 20 times greater than the normal population. And this was based on a study done in Sweden, and the study followed the adults for 30 years after their surgery. And this is very significant because Sweden is extremely LGBT affirming. So what this tells us is that bullying, harassment, homophobia, transphobia is not the cause of suicides. Because if all that alleged homophobia and transphobia were the culprit, you would not see a 20-fold increase in suicide as compared to the normal population in Sweden. Next slide, please. So, in short, This is why the American College of Pediatricians has come out, and we have urged school legislators, anyone who has influence over children, we have urged them to reject the transgender agenda. I mean, to put it quite simply, this is child abuse. A lifetime of chemical and surgical impersonation of the opposite sex is not normal, and it is not helpful. Thank you very much.